More time. A casual conversational cartoon curriculum. Very concise and relatively correct as soon as possible, as simple as possible. A and P. Here we are in our fifth installment of chapter 22. So, last time we were together, we had talked about, natural killer cells. Now we're on to inflammation here. Okay, inflammation is still part of the second line of defense. First line of defense, skin and intact mucous membranes. Second line of defense, all those things between the skin and mucous membranes, and your third line of defense, which is your immune system, T cells and B cells. So all the characters in between right here. So look, the ones doing hand-to-hand fighting without the special weaponry. Inflammation. Okay, as it says right here, the purpose of inflammation is to contain damage, to clear an area, and to concentrate repair. Now, generally, it's said that there are 4 cardinal signs to inflammation. The word cardinal here doesn't necessarily refer to red. It refers to the idea that on a map, you have a signature which says north, south, east, and west. So somebody picked 4 because it was kind of convenient. Nowadays, I like to say there's 5 cardinal signs. Not so convenient. These signs are edema, redness, heat, pain, and the 5th one is impaired function. Now, the purpose of inflammation is, again, to create a battlefield and help concentrate your body's efforts on that battlefield. Also, it's meant to reduce the amount of damage being caused by the pathogen or whatever the problem source is, and to prevent the spread of the pathogen. Okay, with this in mind, let me go ahead and throw some scribble pictures at you. Here we go. Let's say, for example, that this is a blood vessel right here. You betcha by golly. Sitting outside this blood vessel is a community of cells. Let's keep it simple. Let's say that into this community of cells, some kind of pathogen appears. Don't know what it is, don't know how it got there. But this thing might be advertising itself by chemicals that it's releasing. If it were a cell, of course, it'd make waste products and sort of give itself away that way. It might also be causing damage to local cells, and those chemicals spilled out would be advertising that something's not right. Now, into this story, let's throw a mast cell. Now, mast cells are commonly just patrolling the body through interstitial spaces, areolar tissue, a very common thing. They come around and they catch a whiff of this chemical right here. And using chemotaxis, they go from where the concentration of the chemical is weak to where it becomes stronger and stronger and stronger. And by doing so, they find their way to the source, the damage, or in this case, the pathogen. When they bump into damage on this scale right here, they put out their own little chemical smell. And these are granules inside that burst to the outside edge, and they dump a variety of chemicals out here. Now, one of the major chemicals that's released is histamine. There's cytokines, there's prostaglandins, there's a bunch of things that are released, but histamine is one of the major ones. Now, the histamine is responsible for many, if not most, many or not most, of the symptoms, the 4 cardinal signs of inflammation. Okay, among other things, the histamine will cause local blood vessels to vasodilate. Okay, they become larger, wider. Because of the vasodilation, the amount of blood that was flowing through now increases dramatically. And with that blood comes the heat of the blood into this region, extra heat into this region right here, extra color in the form of redness right there. And so therefore 2 of the cardinal signs of inflammation, heat and redness, can be attributed to the vasodilation of the blood vessels in this region right here. Now, the histamine also causes the endothelial cells to become leakier and to allow more material to leave the blood. This extra material that's leaving is called exudate. And because extra fluid is moving into the interstitial spaces, that causes edema. And with edema, the cells kind of sort of back away from each other, and they create more space between them. So, when it comes around to the cardinal signs, we've identified at least 3 of them right now. Let's go back to some words here. Hyperemia. Emia means blood condition, hyper means more. The increase of blood flow to the region is hyperemia, and that accounts for the increased redness in that area and the increased heat. Because the capillaries became more permeable, more fluid got out. That fluid is called exudate. And again, as far as what chemicals are being released by the mast cell, well, there are things such as cytokines and kinins, histamine and prostaglandins. Again, it's the histamines that basically increase the permeability of the endothelium and acts as a vasodilator. Something to be said about these words here real quick. Because there are so many chemicals that might be identified as part of this and other processes in the defense of the body, sometimes we go for generic words. And here's a good one, the KIN. KIN, like in the word kinetic, refers to motion or activate. So if you want a good generic word for chemicals that activate things, you can call them kinins. Or if you're specifically saying a cell that activates other cells, you might call them cytokines. So these are just group names for activating chemicals. So coming out of the granules of the mast cell, a wide variety of cytokines, kinins, also histamine and prostaglandins. Let's say something about prostaglandins, because prostaglandins has to do with pain. It enhances pain. So we mentioned that when it came around to the 4 cardinal signs, there was heat, redness, edema, swelling, but also pain. Now, one explanation is the prostaglandins create pain. Another explanation, of course, is with edema, you have things such as nerve fibers that are being stretched out of their normal position that causes stray signals to be created, and perhaps those signals coming back to your brain not being interpreted properly just come in as static. And your brain may think, well, that's not just static, that is an alarm, and that is pain. So again, one possibility for why the pain shows up. The 5th cardinal sign is called impairment of function. And that basically has to do with the edema. Because if this damage right here happened at a joint, and you had edema at a joint, like a finger joint or something like that, you can imagine this area swells up. And when it swells up, it just won't bend very well. So there you have impairment of function. Now, the logic behind impairment of function is, well, like the old joke, doctor, it hurts when I do this. Well, don't do that. Oh, okay. So if you cause the joint become less flexible, it'll be used less, and there's a better possibility that the damage done can now be repaired. Using something that's damaged doesn't really make a whole lot of sense. You just make the damage worse. So back to the big story right here. We have covered the idea of cytokines, histamines, and forgot about the prostaglandins again. They do enhance the pain, but here's a curious thing. It turns out that aspirin specifically works against prostaglandins. So we weren't exactly sure what aspirin did for decades and decades and decades. We just knew that it worked. But now they have identified the thing that it specifically works against. It works against the prostaglandins. Some other things to keep in mind, the edema. The edema dilutes waste and toxin. If something was damaged, if something is polluting the area, edema tends to spread out the pollutants. It dilutes it. It also creates space for white blood cells and proteins. When the cells back off, other white blood cells, such as macrophages, that just happen to be in the neighborhood, now can move on in. And they can more readily find the targets because the cells have been pushed backwards. Sort of like separating the trees when you're trying to run through a forest. It's a little bit easier if they were farther apart. And then fencing off the area with clotting proteins. Some of the things that are part of the exudate include like fibrinogen and other clotting proteins. These clotting proteins can then react along the edge of the inflammation and in essence put down a fence to make it difficult for things inside like the pathogens to get out and to keep things just from drifting. Again, it helps you focus your attack in that region right there. So once again, inflammation, 4 cardinal signs. Again, edema, redness, heat, and pain. We explained that, but also impaired function. Vocabulary terms such as hyperemia and exudate, cytokines, kinins. Know the general function of histamine and prostaglandins. Next down here is phagocyte mobilization. With phagocyte mobilization, well, the chemicals released right here can also stimulate white blood cells to move into this region right here, attracting neighboring white blood cells. On a grander scale, chemicals released in some kind of defense mechanism right here can cause the neutrophils to arrive quicker, better, more numbers, and neutrophils usually arrive within an hour of some kind of infection. The macrophages take about 12 hours to get there. So again, the neutrophils hold the line, buy time, so that these guys can convert from monocytes to macrophages so they can show up and get the glory at the end right there. Leukocytosis refers to increasing the number of white blood cells, and the amount of circulating neutrophils inside your blood can go up 5 times the normal amount at the beginning of an infection. Marginalization, diapedesis, and chemotaxis all talk about how do the white blood cells find the target if they're coming downstream. Okay, so here's that story real quick. Here's a blood vessel, and let's say there's some damage going on over here. Chemicals in this region right here can affect endothelial cells to create markers called CAMs, capillary adhesion molecules. Now, the CAMs are almost like somebody putting out orange cones on the side of the road to sort of show somebody where they should stop their car, but there's damage over here. It's like a warning sign. Now, the white blood cells are moving down through the blood. They can be affected by these whiffs of chemicals that are being released from this damaged area. They can pull to the side of the streaming blood. That's called marginalization. They can find a gap inside the wall and move through. That's called diapedesis. Di means across, ped means foot, so they're stepping across. And then through the process of chemotaxis, they can zigzag their way and try to find the source of the chemical. So because things diffuse from greater to lesser concentration, if the object is right here and it's putting out some kind of chemicals, the chemicals would be more concentrated near it, less farther away. The white blood cell goes from less concentrated towards more concentrated, and that's how they find the target and why they react to the target. So capillary adhesion molecules help the white blood cell find the place to leave the circulating blood, but then the chemistry and the interstitial fluid help the white blood cell find the particular target, whether it's one of your cells that's damaged or perhaps some pathogen that's creating fluids and such. Before we lose this thing, let's say something about pus. Pus is just the accumulation of dead white blood cells, cell fragments, and fluids from some kind of an infection, some kind of a battle. An abscess, well, an abscess usually refers to accumulation of pus that's below the surface of the skin, perhaps surrounded by collagenous fibers. So it's a pocket of pus below the surface of the skin. Infectious granuloma, well, oma refers to a growth like a tumor, and in this case right here, it's referring to an abscess that may still have live pathogens or viral or virulent pathogens inside of it. So this is like a pocket of pus. Now, surrounded by collagenous fibers and encapsulated, this thing is not dangerous. But if it's broken open, again, those pathogens, which are still viable, can get out and cause problems. So that's the problem of infectious granulomas.